Hi, this is Dr. Shirlea North from North Star Physical Therapy, and welcome to the podcast for all those that are new to listening. Thank you for taking a chance, and hope you get some fun little tidbits from today's episode, as well as take a peek at the other ones. Can't believe we're already in the 60-some episode here, which is great. And thank you for those that are returning. We are releasing this episode in the month of June, and June is not only all about Pride Month, which woo-hoo, but also for male pelvic health. With Father's Day and everything, I really wanted to make some episodes directly for that population. So the language I'll be using will be more binary and specific to male. But don't not listen to the rest of it, because you may have a family member or a friend that may resonate with these symptoms and things. And so I just want to make sure we are spreading the education, spreading the love, and everybody deserves to be helped in pelvic and lymphatic health. So for today's episode, we are going to be talking a little bit about prostatitis and male pelvic pain. Male pelvic pain is a very general term, right? And what I'm also finding is prostatitis. So prostatitis, fancy pants, where when you break it down, it literally means inflammation of the prostate. So when someone gets diagnosed with prostatitis, we're assuming things, right? We're assuming there is something going on with the prostate, and that's why it's getting inflamed. And so that is typically managed with, there's like an infection potentially there. We want to obviously rule out anything more serious like prostate cancer, and that's why men need to be having their prostate exams as well as getting their PSA numbers checked on a regular basis, so that you're nipping that in the butt, not literally but figuratively, and that's being addressed. Now, if there really truly is an infection of the prostate, which makes it be inflamed, then absolutely a course of antibiotics are warranted. What my problem is that there is this assumed inflammation because of the pain in that general area, and these men get put on an antibiotic when they don't need to. It's very similar to how when women get a UTI symptoms, they get put on antibiotics and they don't need to because there's no infection present. So when no infection is present, do not get put on an antibiotic just in case. That's a bunch of baloney. Do not do it, because then your body is going to start to become resistant to antibiotics and to certain infections, and it just is a vicious cycle. And why would you want to have a potential side effect of a bowel issue because the antibiotic you're on for an infection you don't have? Doesn't make sense. So I don't know how many men, go to the urologist, have pain in that general area of, oh, that must be inflamed. Here's an antibiotic. Do this for 7 days and we'll let you know what the culture says. No, you can refuse that. And so there's got to be something else. And a lot of times when with a rectal exam, you can palpate the prostate and you can really easily feel if that is tender. They're going to let you know. If it feels kind of like a bogginess, just heaviness there, it's like a walnut-shaped organ. And so if you're on either side of it, if that, again, is tender, if it is really boggy and squishy, and that also brings on some tenderness, it's okay, then maybe there is some inflammation there. But if you're just going off of, oh, it just hurts by my bladder or at the base of my penis, like that is not enough to go off of to get a diagnosis of prostatitis. So men, do better, okay? Providers definitely do better, but know that just because they said antibiotic, I would ask, is there infection present? If there isn't, I'm not going on it. So prostatitis can also be mistaken for other pain-related diagnoses like interstitial cystitis, like pudendal neuralgia, dyspareunia, all fancy pants words for pretty much pelvic pain. So we want to really find the underlying causes of the pelvic pain. Is it truly an inflamed prostate? When an inflamed prostate is happening, it can be painful for urination. There can be a lot of hesitancy or start-stop because we want to know the anatomy. So the prostate, it's a walnut size, walnut shaped, but it's more like a donut because it's got a hole in the middle of it. And the urethra is what brings the urine from the bladder through that pipe, through the penis, out it goes. And the prostate sits on the bottom of the bladder and right around the bladder neck and the beginning part of the urethra. And so now you can appreciate that if anybody has a prostatectomy, why there are so many urinary symptoms that may occur prior to and post-ectomy. Or if someone has prostate cancer and there's radiation maybe to the area instead of just a flat-out removal, can also have urinary issues. It's just because of where it's sitting. Okay, so if there's more urinary focus pelvic pain symptoms, then yes, we want to rule out anything going on with the bladder. We want to rule out anything going with the prostate itself. We also need to take a step back and see what about the soft tissue that's there, any kind of restrictions, how is our positioning when we're urinating, are we sitting, are we standing, do we have any constipation. So some male pelvic pain can be more related to constipation, and we're looking at that end of the area. If there is constipation, if you're literally full of shit, right, and that rectum has that stool that's right there, it's going to compress against the bladder, urethra, and prostate. Okay, so if you're having a hesitancy or start-stop or feel like you have to push through to urinate, but your prostate's looking fine, your bladder's looking fine, you're all just like, I don't know. And if we just ask the question, are you constipated? How frequent are your bowel movements? What consistency are your bowel movements? Do you feel like you need to really push through or really bear down there? A lot of times when we fix one end, we're going to be helping the symptoms on the other end, because it's in the pelvic floor region there. It's a very small area with a lot of major functions. Pelvic pain can also be from a whole host of other things. It could be from, yes, surgeries and things like that, absolutely. It could be coming from like nerve entrapment, like the pudendal neuralgia kind of a thing. It could be a whole host of different things. So when someone comes in with pelvic pain, we're really trying to find that root cause. We're looking at their onion, so to speak, their layers, and how about their erectile tissue? Can we achieve an erection? How full is that erection? Is there any pain in the climax? Is the pelvic pain within the act of penetrative sex? Do you have pain when you're being penetrated? Are you having pain when you're being the penetrator? Is it any pain during foreplay? Is there any pain during climax? Look at all those questions. I just asked about urinary, bowel, and sexual function, and that could all be a root cause or contributing factor. Then we're looking at the hip and low back and knees and feet and our mid back and how we move, how we squat, how we go from lying down to stand, how are we running, how are we walking, what's our mechanics like. And that could be giving rise. Are there some weird movement patterns that you have compensated for because of an old back injury, because of a knee injury you had as a kid, all sorts of different things. And so male pelvic pain is something that a pelvic floor physical therapist should be in the first line of healthcare providers to help find those root causes. So I just want to help empower that. Just because you got a diagnosis of prostatitis, number one, we really want to make sure it is an inflamed prostate and you're getting the right medical care for that. But if the prostate is looking fine, correct, like size, and upon palpation there isn't any pain with that, then what else is going on that's not prostatitis? It is something else, and it could just be a painful pelvis. I want to see, is it bone? Is it ligament? Is it muscle? Is it your nervous system? How well are you sleeping? Do you have any active stress management strategies? Because the nervous system plays a massive role in pelvic health function. That if you're in pain or anxious or worried about something, you're maybe going to guard, right? You're going to tense up. Down there tenses up too. So oftentimes I am leading somebody through a lot of mobility exercises and stretches. We're working through some breathing techniques, especially when you're working out versus relaxation. We're working through active stress management techniques and any kind of soft tissue tension that might be there. We may need to ask for another professional coming in for mental and behavioral health, because maybe this pelvic pain really was a prior trauma that was just subdued, that now that we're finally addressing it because of the layers that's been added on, it's now stirring that back up again. And how do we work on that? Or is that pelvic pain restricting you from being intimate with your partner? And because like you and your partner maybe want to have a child and want to do that with vaginal penetration, and it just hurts to do that, and you're sucking it up because she wants a baby. We need to be able to address those things, right? Everybody deserves to have proper urinary, bowel, and sexual function, and that absolutely includes men. And so if you have any kind of pelvic pain doing anything, any kind of activity, even at rest, you absolutely should be getting a pelvic floor physical therapist on board. All right, so I hope if anything else, guys, start talking about your pelvis, okay? But don't be bragging about your size or the motion of the ocean and that crap, okay? It's more of making sure that all the 6 major functions of the pelvis, of bladder function, urinary function, bowel function, sexual function, stability of the pelvic bones and skeleton there, supporting the organs and soft tissue, and lymphatic drainage of that area. So if you had any surgery, radiation, or anything like that, lymphatic system is absolutely involved, and it needs to reduce and decongest. Sometimes that pelvic pain could be from the swelling from other things. Could be the swelling from that prostatitis that never really went away 100%. The infection's gone, but the swelling, the extra fluid is still there. Maybe we need to do some soft tissue work and some decongestion techniques, maybe adjusting the compression in that area so we can really decongest that. So there are 6 different functions of the pelvis for any pelvis, for female, male, and anyone else, right? So males, men, guys, y'all need to talk about any kind of symptoms or issues. There's no bad question or wrong question or stupid question to be asking your healthcare provider. And whenever you're in doubt of that, get connected with the pelvic floor physical therapist, and there is never too much information in our offices. So we are more than welcome and happy to help guide that question. I get asked all sorts of different things every single day. Sometimes I know the answer, sometimes I don't. Sometimes I refer to someone else, sometimes I refer to another resource. And that is okay, but as long as I'm helping my client get to that answer or and figure out what's right for them and to help normalize the conversation, I do my job well. All right, so everyone, guys, if you have any kind of pelvic pain or pressure, please get that checked out by a pelvic floor physical therapist, and we will absolutely help you. All right, and until next time.